So many of us are walking around existing with chronic pain in our necks and in our backs, but it doesn't have to be that way. I'm in Moore County at the First Health Center for Fitness and Rehabilitation talking with Dr. Paul Kuzma. What are your patients telling you about the reasons they come in with the chronic pain?
Well, back and neck pain is a very common problem. Back pain may be the second or third most common reason why people come in to visit their physicians. Most times it's self-limiting and can be treated with very conservative therapies, but sometimes it becomes more of a problem. If it doesn't go away with simple things like rest and ice and Motrin, then it may be time to get evaluated. Common causes of back pain can be muscular strain, can be arthritic changes of the joints, or very commonly problems with the intervertebral discs, the cushions that exist in our spine.
How do you treat it?
It really depends. It's a very individualized treatment. The first thing we want to do is try to secure a diagnosis. If we can figure out where the pain's coming from, we can develop a treatment plan that will address that person individually.
There are lots of options. I know one of the reasons, speaking for myself, that I haven't done much about it in years is worry about surgery, just wanting to do something that's less aggressive. Do you have other options?
Absolutely. A large focus of our practice is non-operative treatment of back and neck pain, so spinal pain conditions. Most times surgery is not necessary. If we see patients who come into our practice who have clearly neurological deficits, then surgery may be indicated. The majority of patients who have back or neck pain will be effectively treated and successfully treated non-surgically.
Physical therapist Heather McMillan works on treating some of that chronic pain. And you have a special system here that you call ART. What is that?
We do. We have two therapists that are certified in ART, which is active release technique. And basically, we go and we look at the injury and the soft tissue to see what might be involved in causing the pain.
Okay. And so how does that help a patient?
When you get injured, sometimes you get restrictions and adhesions, and that means the muscles can't function, can't move as well, it results in pain. So basically, we go through, we find where these restrictions are, and we use our hands, certain techniques, to release them so that we restore movement and normal function.
Right. We're here in front of this beautiful warm pool. I'm sure the water also helps when it comes to therapy.
Water is very beneficial for our back patients. Water up to your waist takes off 50% of all of the weight, and so it unloads all of the joints from the lower body. When you go up to the mid-chest, it's 75% of your body weight, and when you get up to your shoulders, it's 90% of your weight is off your joints. So that's why you can do so much in the water that you can't do on land.
Right. So when someone comes in for therapy, is that something they need to go through for the rest of their life, or can you fix a problem in a short amount of time?
Well, we'd like to get them on the right track.
Okay.
When we get a chronic back pain patient, they have degeneration, they have arthritis, there are changes to the normal structure. So what we find works best for patients is that we give them guidance for a program, and we may get them out of that acute pain that they're in. And then long term, they can manage it themselves with an exercise program that may include them doing exercises in the water, sometimes for the rest of their life.
Thank you so much. It's been a great education.
You're welcome.
And you can learn more by visiting the website, the address, firsthealth.org.